But right now I have a few patients that I need to go check up on quickly. If you have a few minutes to wait, I can come back and we can discuss William's illness more in depth. I'd also like to take some time and discuss the medication management and plan with you. Additionally, I strongly encourage you to visit NAMI's website to learn further about their psychoeducational classes for families and their mentally ill family members. I highly recommend them.
Yes, doctor, we will definitely do that. But in the meantime, what can we do to help Billy?
Well, if I understand correctly, prior to getting sick, he was fairly active doing triathlons and bike races. Is that correct?
Oh yeah, in fact our whole family really enjoys exercise and physical activity. It's something we all did together, hiking, swimming at the beach, rollerblading. It really brought us together really closely.
Well, that's great to hear. We have a nurse on staff actually. Her name is Sue. Sue has spent a lot of time researching the benefits of exercise, such as yoga for schizophrenics. She's also developed an exercise plan to implement for our patients who are interested. If you'd like, I can send her in to explain further. It may prove to be a great exercise to do with William once he's stable and out of the hospital. Something you can implement immediately when he arrives home.
Thanks, doctor. We would really appreciate that.
Great. I'll go get Sue and I'll check on my other patients. When I return later, we can discuss more and get some of your questions answered.
Picnic into a bus skip home.
Don't worry, Billy. We're going to take good care of him.
Bus skip home into a
I know.
little bus skip. Jump picnic into a bus skip home. Skip home.
Hello. Hello, Mr. and Mrs. Friedberg. How are you doing today?
Well, this appointment has certainly been unexpected and very emotional. Basically turning our whole worlds upside down.
Upside down. Upside down. Upside down. Upside down.
Billy, please, enough. I'm
Upside
sorry, Sue.
Oh, that's okay.
Upside down.
No worries at all. This is actually quite normal for a patient with schizophrenia. I understand that this must be a very difficult time for you all. We're here to help everybody cope and make adjustments. Dr. Jonas told me that Billy has led an active lifestyle prior to getting sick.
Upside down.
Yes, actually, he's an avid biker, hiker, basically anything outdoors. Dr. Jonas told us that you developed some sort of exercise program for patients with schizophrenia that I guess would help him manage his symptoms. What is the exercise? I mean, will it really help or is it just going to be some time-consuming activity?
Well, I understand your concerns, and the exercise program was actually designed based on research done by people in the field. All the studies had shown that schizophrenics responded positively to exercise and showed they increased their quality of life, and they also reported decreased amount of positive and negative symptoms of the illness. The groups that did not participate in the exercise programs actually showed worsening symptoms throughout the studies. Researchers used various types of exercise interventions. However, yoga seemed to be the most, to show the most improvement in the patient and their quality of life and overall symptoms.
Yoga? No offense, Sue, but I think yoga is for sissies. I mean, look at Billy. He's so strong. He's got the build of an athlete, not a pansy.
Jack, that's not the point. We want him better. Even if this, we have to give it a chance. You know, we need Billy back, so we have to try.
Well, that's a spirit. I understand how you think that it's not a big sport. I mean, it's not considered a workout to everybody, but at this time he needs calming, and yoga allows a better mind-body connection than some exercise. It shows many benefits to them, including decreased symptoms. So by promoting that mind-body connection,
Okay.
especially for schizophrenic patients.
Okay, we'll give it a try. Let's hear some of the details.
Well, that's great to hear. First, we want Billy to see his primary care physician to make sure that he's physically healthy and ready to begin an exercise regimen. Since the psychiatrists here are familiar with the yoga program, we will just let Dr. Jonas know that you guys have agreed to participate. And then before beginning, she will conduct all the baseline assessments of Billy's symptoms and quality of life. After establishing where Billy is initially, she will reassess him on a monthly basis to determine the effectiveness of the program. These checkups can be done while he's at his normal psychotherapy appointments, and you guys don't have to go out of your way. Are there any questions so far?
This all sounds great, but Billy hardly makes any sense. How are we ever going to get him to do yoga?
No, stop it. Stop saying those things.
See what I mean?
No.
Well, I understand your concerns. At this time, he is in an acute phase of the illness, and he does not have the medications to help control the symptoms yet. A few weeks after his medications are started, he should begin to display less symptoms of the illness and be more like his old self. Of course, this is not a guarantee, but he should show improved functioning, and we can always alter the medication plan to get the best results for him. Once the symptoms are better, then we can consider introducing the yoga therapy. Typically, I teach the parents the yoga, or whoever the caregiver is, the routine to give them instruction on the breathing and the poses of each part of the routine. The reason I do this is so that the proper technique and breathing reminders can be enforced at home when he's ready to start.
Well, with all these medical expenses, I doubt I'll have time to watch him do yoga. I'll probably need to pick up extra shifts.
Yes, illness can be expensive. However, when it comes to the time commitment of the therapy, each session is only about 30 minutes. During the first week, when he starts the program, we'll encourage patients to complete one routine for the first week. The second week, we want him to try to do 2 times of yoga per that week. And then the third and subsequent weeks, we want him to aim for 3 yoga sessions each week. Also, you may find that Billy has good days and bad days. This is just part of the illness. If he's struggling with the hallucinations or delusions, he should try to focus on his breath and continue. But if it gets too overwhelming, he can lay down on his mat until he feels more in control or decides that he needs to end the session.
It doesn't sound like, I guess, too much of a time commitment, but I'm still not sure we're always going to have time for the supervision.
Well, that's understandable. Billy may need some supervision at the beginning when the disease is new and the yoga therapy is unfamiliar. But as time progresses, we find that patients can practice on their own depending on their level of functioning and their mental state. We also created a yoga video here at Alexian Brothers, specifically tailored for schizophrenic patients. It encourages calmness, breath focus, and acceptance of everything in life. Once he is more familiar with the practice, he can do it alone on his own time. Also, when it comes to creating an environment conducive to yoga and all its benefits, we encourage a quiet, clean area with natural light and windows that can open for fresh air. Also, it's important that all distractions and interruptions be minimized, as this can irritate the patients, creating more stress and anxiety for them.
Well, that all sounds very doable, and it sounds like he can practice at whatever time is convenient for him, but what if he doesn't practice as much as he should?
Like I said, with schizophrenic patients, we just encourage them to do as much as they can without stressing themselves. When schizophrenic patients are stressed, their symptoms may increase or get worse. So we want to create a balance, not throw them into remission. If Billy relapse. If Billy cannot do all 3 yoga sessions in 1 week, he should not try to play catch up in subsequent weeks. It should be considered a new week and just focus on getting those 3 for that week.
Let's get to him.
So I get that he'll have monthly checkups with Dr. Jonas, but is there any other way we can see how he is doing? A month is a long time, and after learning so much in the past few hours, I know there can be many ups and downs with this illness.
Yes, that's a good question. Actually, I was just about to show you what we use to track his daily, day-to-day progress. We designed a journal for our patients enrolled in the program. It has space for Billy to write down his mood before, during, and after yoga. And it also has a few lines if he wants to elaborate on how he's feeling and why he's feeling that way. So before each session, he should record his current feeling. And then when he finishes with the yoga, he should write down or circle the feeling that he felt during the practice and how he feels after. This way we get to gauge how the yoga is affecting him. We encourage honesty with you, Billy, and you guys too, if you're helping out with this, because he may struggle on days, but it's an important tool for him, and it's going to help him identify the feelings. A lot of times people have difficulty labeling their feelings, so this will be a good way to identify these things, okay? Now that we've covered a lot of it, are there any more questions?
I don't think so, no.
Okay, well, if everyone's open to it, we can go over a few parts of the yoga routine that Billy should be practicing, okay?
Sounds good.
We can, we'll just do a few chair poses. So everybody feet on the ground, posture straight. You can close your eyes. And you want to inhale and bring your arms up slowly. And hold at the top. And exhale. And you'll do that 5 times at the beginning. And then, to wake up your arms, we can do some outward stretching. For that, you really want to focus on your breath. A good way to get focus, this is important too, Billy, if you want to listen up, is just to breathe in and out through your nose and really try to feel the area around your nose, because that's where the breath is going in and out. And over time, you'll build that mind-body connection, and you'll find that things will be more calm for him. Hopefully you guys, if you practice with him, okay? And I'll send you home with the video as well. So if there are no more questions, you two will be able to meet up with Dr. Jonas when he comes back in. And if you or Billy ever have any questions, like problems, concerns, my office number is going to be in the brochure and the information sheet. So you guys can read through it as much as you want as a refresher on the content. And feel free to contact me at any time. Other than that, I will check in with you guys every few weeks just to see how it's going for you guys, not just Billy. See if it's all working, okay?
Alright,
Okay.
sounds
Thank you.
good. Thank you so much.
Yeah, I'm glad you're
It was nice
interested,
meeting
okay? I'm sure I'll see you guys around. It was very nice to meet you, Billy.
John Bitnick.
Yeah. Okay, good luck with everything. Okay, guys?